Chapter 8, Female Reproductive System. Okay, let's look at some formed words here and some examples. Dysmenorrhea, we know that dys was that painful, was one of the words that we see there. So in this case, this is the option of meanings that we would use. This is a painful menstrual, and urea means flow, so painful menstrual flow. Endometriosis. Osis means abnormal condition, endo means within, and metrio means endometrium. So this is an abnormal condition within the endometrium. Mastitis, itis refers to inflammation. Mast refers to breast, so this is inflammation of the breast. Salpingocele, cele means hernia, and salpingo means fallopian tube. So this is a hernia of the fallopian tube. Vaginosis. Osis, again, is abnormal condition. And vagino is vagina. So this is an abnormal condition of the vagina. Bartholin cyst, when we talked earlier about a Bartholin gland, well, that is a glandular structure which can get blocked, and when it gets blocked, it can cause a tender, swollen lump in that area. Can be on the right side or the left side. Then it becomes potentially can become infected. If it becomes infected, then it's referred to as a Bartholin abscess, typically. Cervical cancer is a malignant tumor of the cervix. Typically, it begins as a cervical dysplasia and then progresses into a cervical cancer. Most common cause of these is human papillomavirus. Pelvic inflammatory disease is an inflammation of all or part of the pelvic organs that by typically a microorganism, a pathogen, if not treated adequately, the potential is it can continue to ascend and progress into the other reproductive structures and ultimately can potentially cause infertility and even go all the way into making the person actually septic. Uterovaginal prolapse is a dropping of the uterus or a relaxing of the uterus, basically because the pelvic muscles become weakened. And as a result, the uterus kind of tends to drop downward to varying degrees. Vaginal fistula is an abnormal connection between the vagina and another organ. It can be the urinary system, it can be the rectum, just depends on which location that might be happening in. Okay, surgical terms, in this case from word parts. Examples, colpoperineal In this case, oriphy refers to suturing or means suturing. Colpo means vagina, and perineal refers to perineum. So this is suturing of the vagina and the perineum. Colpoplasty, plasty means surgical repair. Colpo again means vagina, so this is surgical repair of the vagina. Hysterectomy. Ectomy is excision, so it's excision of the uterus. Mastectomy, again, ectomy means excision, and this is excision of a breast. Salpingostomy. Ostomy is creation of an artificial opening, and salpingo is the location, so this is creation of an artificial opening in the fallopian tube. In this case, it's done because the fallopian tube, instead of having the hole going through the fallopian tube, it is prematurely, abnormally closed, and so what they're trying to do is opening the tube back up. Okay, those that are not built from word parts include anterior and posterior colporrhaphy, or AMP repair, very common reference here. A colporrhaphy is really a surgical repair of the vaginal wall because of a weakness from the protrusion of the bladder, which would be a cystocele, or a protrusion of the rectum, which would be a rectocele. And so what they're doing is basically repairing this weakness and suspending these structures. Conization is a surgical removal of a cone-shaped portion of the cervix, and typically it's done to treat non-invasive cancer of the cervix. Endometrial ablation, this is a procedure where they use a laser to destroy or remove endometrial tissue. Can also use thermal energy or electrical energy. And it can also be used to treat abnormal uterine bleeding. Tubal ligation is surgically closing the fallopian tubes, and this is done for sterilization as a sterilization procedure. This can be done in various different ways. They can cut the tubes, tie the tubes, or cauterize the tubes, burn them, in other words, or they may band or clamp them off. So a lot of different variations in how this might actually be done, but the procedure itself is surgical closure of the fallopian tubes, and typically be for the desire for sterilization. In part two, we're going to look at defining, pronouncing, and spelling diagnostic terms and complementary terms. And we're going to interpret some abbreviations and look at a clinical application of the terminology. Diagnostic terms built from word parts include a colposcope. Well, we know scope means instrument used for visual examination, and colpo refers to vagina, so this is an instrument used for visual examination of the vagina. Hysteroscopy. Scopy means a visual examination of the uterus, and visual examination, and hystero refers to the uterus. So visual examination of the uterus is the definition of hysteroscopy. Mammogram. Gram is a radiographic image, and mammo is breast. So this is a radiographic image of the breast. Sonohysterography is a process of recording the uterus by the use of sound. Ography is a process of recording a sonorous sound history is uterus, and this is used typically looking for abnormalities like polyps or fibroids, or maybe adhesions, which is scarring within inside the uterus. Okay, examples that are not built from word parts. The CA-125 test is a laboratory blood test that's used in treatment of ovarian cancer and to detect if there is a recurrence of ovarian cancer. PAP test is a cytologic study, which means it's a study of the cells of the cervix and vaginal secretions looking for abnormal and cancerous cells. So in this case, it's looking at the cells specifically. Sentinel node lymph node biopsy. This is done. It's actually a test that would be a radiologic type test. It's done by injecting blue dye, and they're using it to identify sentinel nodes. And sentinel nodes are the nodes that are closest to cancer, but they're looking for sentinel nodes in the axillary chain, which are most likely to show metastasis from a breast cancer episode. Transvaginal sonography is an ultrasound procedure that where the transducer is placed inside the vagina, and they are looking at the ovaries and the uterus and the cervix and the fallopian tubes, and all of those structures, looking for ovarian masses or tumors. They also may do it as a part of pregnancy, and basically evaluation in infertility cases as well. Some complementary terms built from word parts. Endocervical. AL is pertaining to, endo means within, and cervicos is cervix, so this is pertaining to within the cervix. Leukorrhea, we have the word, the suffix that means flow, urea, but it also can mean discharge. So we have discharge. Leuco means white, so this is a whitish discharge. Mastalgia. Algia means pain. Mast means breast, so this is breast pain. Vulvovaginal. AL is pertaining to, vulvo is vulva, and vagina is vagina. So this is pertaining to the vulva and vagina. Examples not built from word parts include anovulation, and even though there's not a straightforward definition based upon word parts, in some cases you can get a hint of the direction of the term, but not the exact definition. So anovulation is failure of the ovary to release an egg. So at least you do get some sense of the terminology there. Dyspareunia. This is difficult or painful intercourse. Speculum is an instrument used to open a body cavity for visual examination. Menarche is the beginning of menstruation or the first menstrual cycle. Menopause is cessation or stoppage of menstruation, and this is typically somewhat age-related, and we see this happening quite often around 48, 53 years of age. However, it can also be as a result of surgical, such as removing the ovaries, or it can also be as a result of chemotherapy treatment. So really three particularly different causes for this maybe. Abbreviation examples are DNC, and note here one of the common misunderstandings is that sometimes people want to put the letter N in this instead of the ampersand for and. So this is D and C, or dilation and curettage is the meaning. FCC is fibrocystic breast changes. HSG is hysterosalpingogram. IUD is intrauterine device. And TLH is total laparoscopic hysterectomy. Looking at a clinical application again, and as I read through, read with me, especially the bolded wording in each of these. The breast is the most common site of cancer in women. More than 80% of breast cancer is infiltrating ductal cancer, IDC, which originates in the mammary glands. The rate of growth depends on hormonal influences. As long as the cancer remains in the duct, it can be considered non-invasive and is called ductal carcinoma in situ, or DCIS. Mammography is the most common method used for diagnosing cancer of the breast. Confirmation is done with biopsy obtained by conventional surgery or guided breast biopsy, such as stereotactic breast biopsy. Treatment may include lumpectomy, mastectomy, chemotherapy, radiation, and hormonal therapy.